COVID affects every system in the body, so it affects the lungs, it affects the blood, it affects many of the other systems, the kidneys. So many of the things we were doing now are no different than what we were doing before. We're taking care of the whole person as a whole person, and we're just trying to minimize the effects that COVID is placing on their systems. We've been very fortunate to be able to empty out the one floor and maintain one dedicated space to caring for these patients and one dedicated group of individuals to care for them. So with us being the chosen or designated unit, we've been able to really understand what we need to do to care for them and how best to care for them.
Those that are symptomatic from a COVID perspective, most of it is manifesting in the lungs. We're managing their oxygen levels and providing therapy if that's needed. Sometimes they're requiring some antibiotics, but otherwise we've been grateful that we haven't been hit as hard as some other places worldwide.
I think assessment skills are the one thing that is most important when we're taking care of these patients. So we're trying to assess them without exposing ourselves. So we're having to be careful how close we get to their upper airways, especially if they're coughing a lot. So we may not be listening to their lungs, but we may be looking at some of the other things that are happening with them. Before COVID, we always used PPE. So we used PPE for people who had, say, tuberculosis or C. diff, influenza. It takes some time getting good at donning and doffing the PPE to go into the rooms and making sure that we're not contaminating ourselves in the process. Most of our staff have been able to remain in the floor, so that has helped make the teamwork easier, knowing people's ins and outs, but we have definitely had to rely more on the people around us. So once you enter a room, you try not to leave the rooms. Everybody knows that if a call bell is going, it's most likely one of the nurses in the room who requires assistance. So there's things being passed into the rooms and so that there's no contamination happening.
Probably the most thing I'll remember is how difficult it has been for family just because of the no visitation rules. And so we've been doing a lot of FaceTime to help families and patients get through that.
You come onto the floor and you know exactly who's going to be there, and nobody else comes throughout the day, right? You see very few people coming and going. We're used to having hundreds of people or large amounts of people all in one space all at the same time, and we're not seeing that anymore. So big changes, a little eerie sometimes. It has been a very interesting time and a very stressful time. So we're doing lots of changes every day, and we're rolling with the punches.